Hi everyone. Hello YouTube subscribers and hello people that just dropping by because you're interested in the content or you're seeking help or trying to find someone that you can relate to that gets hemiplegic migraine. Well, here I am. Right here. I want to talk about my last hemiplegic migraine that I had, which was this past Saturday, and today is Friday, so last Saturday I experienced a hemiplegic migraine that was very concerning to me because it presented itself in a different way than it usually does. Hemiplegic migraines are already terrifying enough, and when having another hemiplegic migraine that presents itself differently, it makes it even more scary and horrific. Maybe I can speak for myself, I don't know, but I don't know about you, but having stroke symptoms and experiencing them in a way that is different from usual can pretty much, make you afraid, and as I was. So let's talk about, if you haven't gone through my hemiplegic migraine part 1 and part 2, brief overview is that migraines are not just headaches, they are a neurological disease. So they are understudied and not really understood that well, which doesn't help. There are preventative medications out there. However, they do and don't work for certain people. So in my case, I just choose to use ibuprofen, and that usually helps with, some orange juice or something with vitamin C in it. I think everyone has their own little antidote, but hemiplegic migraines are terrifying. They are essentially mimicking the exact symptoms of a stroke. So it's really, really, really terrifying, especially if you've had your first one or first episode, or if you even get them in general. It's terrible. There's no other way to beat around it. It's absolutely horrific. So they're very rare, but of course I get them along with every other thing that is rare. Yes, I do feel sorry for myself because they cause me to be disabled, and they happen intermittently with regular migraines or classic migraines, and I also get tension headaches and cluster headaches as well. So it's just a big field of bullshit for me with all my health problems, and I'm not going to talk about the other ones because we're not here to talk about those. So you're like, okay, well, I didn't see your part 1 or part 2, so what the heck is a hemiplegic migraine? Okay, hemiplegic migraine. So hemi means one side, right? Plegic means paralysis, or neuropathy. Not being able to feel your arms or hands or whatever it is that's affecting. So hemiplegic migraines can do a lot of things. First of all, they're supposed to start on one side of your body. Okay. And they can also cause speech dysphagia, which is the same as similar to having a stroke, where you know what you want to say but you can't deliver the message. So your speech is completely like word salad, right? You can't make sense of what this person's trying to say. That happens to me. You get weakness in your face. You know, you can get weakness anywhere on your body, but hemiplegic migraines specifically are on one side of your body. However, with me, mine starts in my hand usually, and then travels up my arm, goes in here. It'll go in my eyelids, my forehead, in my tongue, and then it'll go on this side and do the same thing into this eyelid, this side of my throat, this arm, and then end over here, and then go down into my leg, right? Or my thigh, and then my leg, and then rarely my feet. But what I'm saying is that the way mine present is that, you know, I call it the march, right? So it's marching, 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 marching. Here comes the numbness, the tingling, the weakness, the paralysis. March, 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 march. I'll even show you my legs. March, 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 march. And then it'll go march, 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 march. Okay, you get the picture. But that is how I feel this paralysis. I've actually had my whole arm go numb out of absolutely nowhere. And it happened for about a half an hour. Like, my arm was dead weight completely. And it was my left one. And this happened when I was like 27. So it was really, really scary. But I was also malnourished at the time because I had an eating disorder. So that is arguably not part of my hemiplegic migraine, but could have been the start of having my hemiplegic migraines. However, other things that I experienced during hemiplegic migraines is an insatiable amount of thirst. Like, I get very, very thirsty. My mouth gets dry, and then when my migraine starts, I usually get the visual aura first. So the visual aura is like when you see those crystal prism-like, you know, circles that start out small and get bigger and bigger and bigger and bigger, like a diamond, you know, like when you put or sequins to the sunshine, that's what it looks like. So for people who are trying to understand other people's migraines, you're going to see these prism things that are going around and around and around and around, and they usually get bigger, 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 and then dissipate. But they usually start small, and you can actually have facial distortion. Like if I looked in the mirror and my face was like all distorted and upside down, I know I'm ready to have a migraine. So that's my prodrome. So the prodrome is everything that happens like in the beginning or before your migraine. So that's my warning, is that I know that when my vision starts to get distorted, then I better brace myself because I'm going to have a migraine. So what else happens to me? It's a very weird phenomenon, is that I feel euphoria. I feel a grand sense of euphoria in my brain, to the point where I feel calm. My brain is calming, which is very different from me. But when I get a migraine, hemiplegic migraine, it is the weirdest thing ever. Like, sometimes I even feel like I'm having an out-of-body experience. And it kind of calms the scary part of the migraine. And maybe that's the body's way of, you know, comforting you while you're going through such discomfort. Could be, right? So anyway, the point of this video is that this past Saturday, I had a migraine that started the way that it usually did, right? Like, I looked in the mirror and I'm like, oh God, you know, like, I'm gonna have a migraine, because I couldn't make sense of my facial features, and everything was like 3D-ish. So I'm like, okay, I can get ready for this. So I take my Advil, usually take about 400 milligrams to begin with, which is a normal dose. And I drink a lot of water, and I sit down and wait for it to go away. So I get a headache, and I usually don't get a headache first, but I did. And then I got the visual aura, and then I'm like, okay, well, my visual aura is gone. All the little prisms were gone, right? So I'm like, yeah, that was a short one. I'm like, thank God. Like, I can go do whatever I need to do and rest. Well, this is where it starts to get different, is that 15 minutes later, I start getting numbness. And I'm like, really? And then the numbness went away, and then it came back. So I'm like, what is going on? So it was almost like it wanted to start, but then it was like hesitating. And so what scared me is that it was not marching in the pattern that I know. Instead, it was going from this hand to be numb, this hand to be numb, and then it went way deeper into my throat area to where I felt it in the back of my throat instead of just my tongue. So that was alarming and very scary. And another thing is that the numbness didn't march its routine march, like up, like I showed you, through the cycle of my legs and then back up. It was completely out of whack. It was out of sync. My pattern wasn't there anymore. The marching was like doing whatever it wanted to do. It was like a person marching here and stopping, and then marching here and stopping, and then marching here and staying here. And then I had chest discomfort, right? And that could have just been from my anxiety because of the migraine. And so I decided to take my blood pressure. So I get out my blood pressure machine. And yes, I can take my own blood pressure with my manual blood pressure thing and my stethoscope. But you get it, like, whatever. So I put my cuff on, and my blood pressure is elevated big time. My baseline is usually around like 97 over 85. Like, I'm super low, okay? So I take my blood pressure during this, and it was like 180 over 88, and I'm like, whoa, right? So I took it again, and it keeps on getting higher. It's not getting progressively less. It's getting worse, which means I'm getting progressively worse. So this migraine, I'm at home, and for something that usually lasts like 20 to a half an hour, like 20 minutes to a half an hour, this has gone on for 2.5 hours so far. So I have no one to help me. I'm scared. I think that something else is wrong because hemiplegic migraines can induce stroke, or not stroke, strike that, coma. It's very, very, very rare for these migraines to put you in a coma. But everything that rare happens to me because for some reason God put me on his shit list when it comes to scary shit. So I'm like, okay, this is not cool. My migraine has been lasting for almost 3 hours now. I'm scared enough to call 911. So I get on the phone. And of course, nobody knows what hemiplegic migraine is. And that's annoying enough because people are incompetent. And they're asking me all these questions about my heart because I told them that my blood pressure was high. But they're ignoring the fact that I told them I'm having a hemiplegic migraine that I think might be a stroke. And it's like one ear out the other, right? And I just expect that because people in general just don't really do a lot of research outside of their job, which you should if you're in the medical field. It's a constant like learning experience, and you should probably, explore, different kinds of pathology and disease, whatever. That's just my opinion. So anyway, I called 911 and the EMT comes to my door and he's like, what seems to be the problem? And I told him I get hemiplegic migraines. And he's like, okay. And I'm thinking, like, this guy has no idea what a fucking hemiplegic migraine is. And he's acting like he knows what it is. And that's wrong. And I said, you know what a hemiplegic migraine is? And he's like, no. So he doesn't know what I'm talking about, nor does he ask me what it is, right? Because he's just too cool for that. So I'm like, well, I'm having like numbness in my throat. I can't feel my hands. I can't do, and he's like, well, how's your chest pressure? How is your blood pressure? And he's thinking I'm having a heart attack. And I'm just like, oh my God, this guy's totally missing the mark. So I'm like, okay, let's go to the hospital, right? So I'm on the EKG, and then in the ambulance it read STEMI, which is bad. And then he's like, oh no, I think this is artifact, which means that it's just from the bumps. So I'm like, okay, I don't feel like I'm having a heart attack, whatever. So he phones the doctor, tells him just about my heart pressure, like pressure in my heart, which would be like angina, whatever. That's chest pain, but same kind of thing. And he said that my blood pressure was elevated, and then they told me to take an aspirin. For people out there in the medical field, what's wrong with that? What do you think is wrong with the aspirin part? Give you a few minutes. The answer is if someone's having stroke symptoms, you don't know whether or not they're having an ischemic stroke or a hemorrhagic stroke, which means a brain bleed. So what does aspirin do to the blood, everybody? It thins it out. So if you have a brain bleed that's causing a stroke, it's contraindicated. That means don't do that. So because he didn't tell the doctor about my neurological symptoms, he could have killed me by giving me an aspirin to someone who's having stroke symptoms. That's why it's important to listen to these kinds of videos so that you can educate yourself on things that are important that other people don't know or don't care to know, or that are just not really worry about it. So the point here is that you have to really understand what you have. You have to understand your body, and you have to understand what is the best thing for you, instead of listening to other people's opinions when they're not educated enough to make that decision. You know what I'm saying? So in that ambulance, I was able to make a decision that could have saved my life. And if I would have been ignorant to the situation or the information, I could have taken an aspirin, and if I was having a brain bleed, I could have died right there. So it's important to understand everything about what you're suffering from. Hemiplegic migraine is very complex, but it's not something that's going to kill you, essentially. It hasn't killed me yet, and I've had tons of them for 20 years, almost 20 years. So going on, when I get to the hospital, I'm in this long line of people on their stretchers, whatever you want to call it, ready to get taken in. So you're in intake, right? Emergency intake. And I'm like, oh my God, this is so bad. Like, this is so bad. And I got nauseous. And I'm like, why am I feeling nauseous? And I'm thinking, boom, like my son inherited this from me, but he vomits all over the place when he gets his. And I'm thinking, holy crap, like, am I getting his kind of migraine today? And the answer was yes. So because they triaged me wrong at the hospital, meaning they didn't put me on high priority because the EMTs didn't note my hemiplegic migraine stroke symptoms because they didn't care and they were completely, airheads. So they thought that I was just having anxiety. So they put me in a holding tent full of people screaming and wailing and having drug overdoses and, having drug withdrawals and things like that. And here I am having a freaking terrible hemiplegic migraine, and the lights were like LED white fluorescent lights on the ceiling. And I'm just like, oh my God, if I die anywhere, it's going to be in this room. So they told me the only way you're going to get out of here and see a doctor is if you either die or you're like literally dying on the floor. So I knew that I wasn't going to be seen within like 48 hours. So I'm like, okay, the hospital is at maximum capacity and overflow. There's 4 tents and I'm in one of them. So I wouldn't be able to see a doctor within 2 days. So I'm better off just doing what? What do you think I did? I left. I withdrew my care from the hospital and I left. I was puking in the porta potty tent toilet. Okay? I was having diarrhea at the same time. That's not typical for me and my migraines, but it was happening. And what I'm telling you is that hemiplegic migraines in my situation can change. They can completely change and present themselves in any way that they feel like it at the particular time. And I've never had a hemiplegic migraine that was the same. So if you're experiencing a hemiplegic migraine and you're scared and you're like, oh my goodness, like, should I call 911? My answer to you is do what you think is best, but make sure you deliver the message to the people and make sure they understand what a hemiplegic migraine is before you even get into a conversation with these people. Make them Google it. Make them Google it. Make them read the description of what it is before they try to convince you that they understand what you're saying. Like, oh yeah, I know what that is. I know what a oh yeah, I've heard about that before. It's like, no. If you can manage yourself at home, do it. I was terrified. I'm still alive. So if you've been diagnosed with hemiplegic migraines by your neurologist, then taking care of it at home would be ideal. But if you feel like your body is in danger and you feel like it's the end of your life, like I did, I felt like I was going to die, then by all means call 911. It's better to be safe than sorry. But in my situation, it was better to stay at home because of the incompetency of the medical staff that I encountered. So that's going to cause more stress on top of your migraine that is going to elongate the process of the migraine process. So my migraine manifested itself and was completely exploded into something totally worse because of my environment. I didn't feel safe. I didn't feel cared for. I didn't feel like I had professional staff. They were all complaining about how tired they were. They don't get paid. They're volunteers. They're talking about what kind of patients they don't like. They don't like respiratory patients. You know, they're talking about a guy that got caught in a rock grinder. You know, they're making fun of like all these patients that they've had. And I'm thinking, wow, these people are really going to make fun of me too, you know? But you know what? Right now, I'm picking on them for not knowing what the hell they were doing. So there, you know, for the people out there who have hemiplegic migraines or want to understand it, I'm here. So I have a large knowledge base about neurology in general, medical stuff, you know, you name it. So if you have a question about hemiplegic migraine or anything that you have concerns about, message me and I'll see it and I'll message you back. And if you're having a problem and if you need help, I'm here to help you. You're not alone. You're going to be okay. And those words of affirmation and empowerment can do a lot to your brain. Have someone brush your hair. Have someone run their fingers over your forehead and calm your nerves. Just calm yourself if you don't have anyone else there to help you. Calm yourself. Release the tension. So there's one more thing I want to talk about is you're like, well, what's your trigger, right? Like what triggers my migraines? Well, for me, it's chewing. You're like, okay. So whenever I chew something that is hard, like nuts or pretzels or chips or something, my TMJ can't handle it. So when I'm chewing, I can't chew gum or anything. It hurts. So right now I'm putting pressure here. It is incredibly painful. So that irritates the, what nerve do you think? The cranial nerve. Any geniuses out there? That would be the 5th cranial nerve, which is the trigeminal nerve. So the trigeminal nerve, when it's aggravated by the muscles of your TMJ, and the TMJ is what connects your jaw or mandible to your skull. These pressure points can then aggravate the muscles around this joint and then aggravate the 5th cranial nerve, which then can cause numbness in your face and in your tongue. So if you have numbness anywhere else, you can do your own research on which nerves innervate what, and what kind of injury do you have that can possibly trigger your migraines. That's an interesting thing to find out, because if you can do that, you can help your medical staff understand better what's going on within your body. So that's what triggers mine. So right now I'm on a pretty liquid diet and a soft diet so that I don't have to chew, because I'm in constant chronic pain here. So anyways, if you're suffering today, I am very sorry that you're suffering. If you're having a hemiplegic migraine, it's going to pass. If you get regular migraines, it's just as terrible. And my heart goes out to you. And I hope this video helps somebody out there. And if it did, like my video. We want to keep these videos positive. So if you don't like it, just keep it to yourself. If you found this helpful, press like, or you can subscribe to my channel, because I have a lot more coming about a bunch of different things. Thanks a lot and have a great day.